us in this session. On behalf of the International Institute of Islamic Waqf, I welcome you and I thank you for making time to be with us in this session. We have participants joining us from different locations in and outside Indonesia. Okay, before we start, I would like to take a moment to introduce the subject and our speaker. The history of Awqaf in Indonesia dates back to the 9th century with the introduction of Islam by Arab traders. And this practice survived and thrived despite the Dutch occupancy of the country from the early 17th century until 1949 or 1950. Today, Indonesia's Awqaf sector is one of the largest in the Muslim world, with a strong institutional framework led by Badan Waqf Indonesia. Indonesia's health sector is undergoing major transformation. With Indonesia's vast population, I think there is, in the last census, 278 million people. It's the world's fourth most populous country, and it has a very large geographical area spread over 17,000 islands, from what I understand. Now, Indonesia's journey towards a robust healthcare system is both ambitious and challenging. The country has made significant strides, but continues to face obstacles along the way. Despite progress in major cities like Jakarta, Surabaya, Bandung, Medan, etc., challenges remain in addressing shortages in rural and remote areas. Financing gaps, workforce shortages, and regional disparities remain pressing issues. Now, this is a great opportunity for us to learn and share knowledge and spark new ideas about the role of Awqaf in supporting the health sector in Indonesia. We are privileged to have with us today Dr. Afdal Al-Yasar, a dedicated scholar and philanthropist, a finance expert, and the founder and chairman of Indonesia's Productive Waqf Foundation for Islamic Asset Management. He is also the founder, CEO of Medikids Waqf, and was the team leader of this project, which pioneered a healthcare Waqf model. Medikids Waqf was awarded the Islamic Development Bank's Prize for Impactful Achievement. Dr. Afdal will share with us valuable insights on how Medikids Waqf is contributing to strengthen healthcare infrastructure, promote equity, and devise sustainable models of community well-being. Now, please join me in welcoming Dr. Afdal Al-Yasar. Dr. Afdal, the floor is yours.
Okay. Thank you, Dr. Isam. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Isam, Dr. Sami, and all the participants in today's webinar. Also, thank you for the International Institute of Islamic Waqf. So we praise to Allah because with the rahmat from Allah, we can gather at this time. Ladies and gentlemen, I will continue what Dr. Isam mentioned about Indonesia and the Waqf development in Indonesia, and recently the initiative that we have developed to handle the issue when the Waqf asset in Indonesia in terms of the number of assets is quite big, but in many areas they are not productive. So allow me to share some screens. Okay. So this is the first time to me to join the webinar for the organization's International Institute of Islamic Waqf. Hopefully we can know each other. My name is Afdal Ali Ansar. I have a long journey in the banking and financial area, but mostly in the non-Islamic economy at the time. But 10 years from now, I just focus to do the Islamic finance, Islamic economy, and try to give better motivations, better initiative, and better movement for the Islamic finance and Islamic economy. Because we know Indonesia also, there are a lot of conventional finance, but I think the situation now, the people of Indonesia are looking for more better financial models to be implemented. Waqf asset is one of the situation that we will handle how to build the better society. Before we continue with some presentation, I will show you the video. Okay, I hope the video connections will be shown better in your screen here.
When compassion meets care, that's where Medikids begins. Built on the values of Waqf, here every treatment is more than a service. It's a contribution, a meaningful act of giving. We believe that every smile we protect holds a story, a hope, and a future worth nurturing. A bright smile is not just a sign of health, it's a reflection of confidence and happiness. Driven by the spirit of Waqf, we're committed to high-quality dental care is not a privilege, but a right. Everyone, regardless their background, deserves a healthy and happy smile. Every profit we earn is not merely for business, but to build a better future through social initiatives. Medikids Waqf managed with utmost professionalism. We deliver exceptional care by skilled medical teams harnessing advanced technology and high-quality materials. Every detail is designed with care, from child-friendly environments to modern dental equipments that ensuring safety and comfort.
When we started Medikids Waqf, our goal is to overcome the challenges of managing Waqf asset in Indonesia by utilizing a comprehensive dental and child development clinic as our source of sustainable funding. Since we started in 2018, Alhamdulillah, our first Medikids Waqf clinic has reached break-even point within the third year and have since delivered significant Waqf benefits not only in health sector but also in education and social services. We hope to continue expanding our impact and delivering even greater benefits in the future.
Panjenengan telah ikut menggerakkan dunia perwakafan dan merubah spektrum perwakafan dari yang tadinya makam, masjid, madrasah, tetapi dengan hadirnya Medikids itu juga bisa bergerak di bidang kesehatan. Oleh karena itu, panjenengan termasuk bagian dari kelompok inovator kebaikan di dalam pengembangan perwakafan.
At Medikids Waqf, we believe that your action shapes a sustainable mission, whereby the impactful movements can last across generations. From our parents to our children, from the past to the present, and it continues to the future. We hope the impact doesn't stop here. Together, let's spread the care and kindness through Waqf.
Okay. So that's the video, but we continue the discussions. If we look at the Waqf potential in Indonesia, we do have many Waqf assets, including land, also school and mosque, and cemeteries. But the problem, land are not productive. School and mosque needs maintenance and renovations, need operational costs to run if something happened, for example, like earthquake, flooded, so it need to be rebuilt. And cemeteries, also lack of maintenance and minimal operations. So the Waqf in Indonesia, majority are not potential, are not productive, and also need so many operational costs to develop. So the challenge is the operationally in deficits, the situations, we can say about 90% of the Waqf assets are classified as unproductive assets. So we look at the situations and then we know that we need to have a sustainable model of Waqf assets. When operational will keep the benefit for the Mu'akkaf, for the beneficiary of the Waqf. And the question, how to do it? So we are trying to combine the Waqf model with the commercial business models. So this is the situation when we try to combine the social purpose with the business purpose through the modern and good quality and also well maintenance of the assets. This is our dream. We want the Waqf asset to be something good, something useful, can be used by a lot of people and also in good maintenance. Not only for the poor, but because of this Waqf can be part of our daily life activities. Why, if we have some problem with our health, we go to the abroad or we go to the non-Muslim hospitals. But when we're talking about duafa, just the hospitals specializing for duafa, they are not operationally have a profit to run that situation. So we want that the Waqf asset can serve Ummah inclusively, regardless their locations coming. In Indonesia, we have so many, ras in Indonesia, from Sumatra, Java, Kalimantan, even the Papua people. We are very different ethnic. So we want the Waqf asset can serve Ummah inclusively. And we also want the Waqf asset need to be grow productively. So in these situations, the starting point, we want to have an Islamic financial business that's inclusive, sustainable, beneficial, and professionally managed. So how to do it? So we look at there are some big part of the issues in the current Waqf situations models: inclusive, sustainable, professional, beneficial. They all can group together in one single initiative that we call a productive Waqf. Sustainable benefit through the productive Waqf is the commercial Waqf. If we invest through the productive assets, the assets will grow. The asset will have a net profit. So from the net profit, then we can share the Waqf beneficial to the beneficiary. But this is not easy, because why? The productive asset need to be taken care by the professional. So we need what we call that Waqf operator. Waqf operator in this situation must come from the people or group who understand the business itself. You cannot have school, modern school, but you don't know how to run the school business. You cannot have a hospital if you don't know the team, if you don't have a team to understand an expert in the health and also become a doctor to understand the need of the hospitals. And you cannot have other business without the professionals. So that's the key point in this initiative, to combine the professional business with the Wakaf initiative. And Yayasan Wakaf Produktif Pengelola Aset Islami Indonesia, that's the name of our foundations. We established that yayasan. So the Wakaf asset from donors to safeguarding and development. So in this, we collaborate with the MHDC Group. MHDC Group is a Wakaf operator who handling the clinic operational. So the Medikits and MHDC already established commercial clinics assets across Indonesia. Currently, we operate more than 40 clinics across Indonesia, majority in Jakarta, and all those clinics are profitable. So how we then combine the Wakf initiative with the professionals clinics operator. So this is the good collaborations. So when I asked to the Medikits founder, for the, if you see the video, Dr. Maimuna and Dr. Anggraini, as a businessman, as a business founders, everyone want to have a dream to develop their assets, to increase their business. But when we try to give them more understanding, when you give donation to people, it's just only donations. People will use your donation for foods and for health, but then this gone. That's all. But if you build something which can continue productively, so then the result will be different. The net profit of the Wakf clinic can serve the Ummah, not only for the poor, for the food donation, but also to support the education for the professionals who have a problem with the educations in dental and medical school. So before we run the foundations, we need first to be compliant with all the regulations, because in Indonesia, everything to become a trusted foundation, a trusted institutions, the Medikits Wakf and also the foundation need to be registered with the Badan Wakaf Indonesia. So this is the first thing I think we need to put as the foundation, become a trusted institutions. We need to be transparent. We need to be accountability and compliance. So our report is open anytime for the Wakif. If Wakif want to look at the financial conditions, it's easily, we can give it to them. And also if they are asking for everything about the transactions, about the income, the distribution of the benefit, we have the record. We have the report for them. So that's the key point. And then for the medical, when we combine the Wakf through the dental and family health clinic, so that's to become the Medikits. I said to you that Medikits already more than 40 clinics across Indonesia, and 12 of them are operate under the Wakaf schemes. So established in 2016, Medikits Clinic is a very strong clinics chain in Indonesia, operate with the good doctors and trusted to give better service, dental service, and also vaccination for the Indonesia society. And yes, the innovation has come when we try to combine the Waqf is the capital of the clinic. So when the Waqf asset become the capital of the clinic will be operate professionally, generate income, and then the net profit of the clinic will become the Waqf distributions to beneficiaries. So that's the cycle. Through that cycle, because of the business, our profitable business, we can continue to grow the Waqf assets and also establish another clinic and another clinic. From one clinic in 2018, and now it's already 7 years, we have 12 clinics with the Waqf concept. So that's the situation, the Medikit Waqf clinic. As I mentioned to you, we want the Waqf asset to be something good, well-maintained, and also can be inclusively for everyone. So we have locations in Depok, East Java, West Java, and also Central Jakarta, and also in Tangerang. And we also have locations, a clinic in Padang, West Sumatra. And actually, I want to develop the clinic outside Indonesia, maybe sometime, some days, maybe in Saudi, in Jordan, and tomorrow we will have a Islamic Finance Conference in Brunei. So the situations will grow, the initiative will going globally, so people can get the benefit from the growing of the Waqf assets. In 2018, when we established that initiative, actually it's very, very difficult for us, because when you're asking people for donation to help the people from war, from flooded, give a food, so it's more easy compare to collect, and I mean to ask people to Waqf their assets. Because when we ask people to give their assets to become a Waqf, a lot of questions will come from them. This is the initiative is will be profit or not, and how you try to do the keep the capital safe, and how you operate this business, and what are the risks involved in this business, etc., etc. So we say to them, this clinic was operated with a professional clinic, which already proven handling a lot of clinics in Indonesia. So that's why we can reduce the risk when we use the professionals, Waqf operators in this situation, this Medikit Waqf. And this is the concept. Maybe a lot of people will try to understand what are the concept of the Medikit Waqf. So the initial Waqf funds, we established the foundations as a Nazir Waqf, and then we invest the Waqf funds to build the first Medikit Waqf clinics. And when Medikit Waqf clinic operates, they give the dental health treatment to the people, and they get payment from the patient. And the income of that clinic will back to the Nazir as a dividends, because of the net profits. And then the Waqf beneficiary distributed, and some of the dividend also reinvest to the new clinic buildings. So with these models, we developed since 2018, our first clinic, and then we built another clinic in the after that through these models. Yes, we start with 1.48 billion IDR at the time. First in Medikids Waqf in Depok, yeah. And then 1 year after that, we start distribute our first Waqf benefit distributions. And as the amanah from our Waqif, the Waqf distributions go for the scholarships. Yeah. So we serve 4,000 patients, more than 4,000 patients at the first year, and then only one student for the awardee. Why only one student? It's too, I mean, people say, okay, why not many? Because we fund the student overall funded. For example, when we fund the student from the medical school, we want the student to complete the study without any problem with the financial. So the tuition fee, books, tools, materials, even computers and transportation costs, we support them. So the awardee need to become a full doctors. So that's the situation. That's why it's not many students that we serve at the beginning. But now in one batch, we can open the scholarship awardee is about 50 students in one batch of the scholarship program. So 2020 start with the more clinic in Cikupa, in Bogor, and 2021 also keep increase the number of patients, and many years after that, we already serve more than 20,000 patients, and also the number of students. By today, it's reaching 100 students. And not only students, because of some of them already graduated from medical and dental school. And they're back to us to become our dentists and our doctors. We pay them professionally. So that's we give them also the hospital, the clinic that they can work there. Okay. Okay. In terms of the locations, yes, most of the clinics are in Jakarta or near Jakarta in Indonesia. If you have come to Jakarta, so you know the situation in Jakarta, Indonesia. But outside Jakarta, we have in Surabaya, we have in Padang, in Sumatra Islands, and now we also established in Kalimantan and Sulawesi. Next month, we will open the new clinic in Batam near Singapore. Yeah, Batam is an island, not so far from Singapore, and also in many areas in Java Island. So this is the milestones when we start our first clinic 2018. We established our foundations to continue, and the first distribution of Waqf benefit, we start just 1 year after the establishment of our foundations, because we want to give something trust to our Waqif. This clinic is generating net profit. So when the clinic generating net profit, we start to distribute the Waqf benefit. So with this scheme, our Waqif are happy, and the model become more trusted in our Waqif. Okay, in Sawangan, near Bogor, Kalimalang in Jakarta, and Medikits in Cilegon, in Banten province, and in Padang, Surabaya, Karawang, Tangerang, continue to develop. Okay, in terms of the assets, actually, since 2018 until 2024, it reached significantly improved. So can say it's more than 10 times. In last report, 2025, so the assets, I think, is more than 20 billion IDR, Alhamdulillah. And the number of clinic now is already 12. Yeah. And not only the number of the clinics, cumulatively, we already serve more than 1,000 patients in our clinics. So it keep increase the benefit, because we run professionally. People pay for the treatment that they get in our clinic with the professional rate, but they understand, because of the net profit in the clinic, not only for business, but also to be distributed as a Waqaf benefits. So it's some, I mean, it's a something interesting way to say, or to give insight to the people, how they understand the beautifulness of the Waqaf through the modern clinics. People will love to pay the treatment, and also some of them also put more donations in our clinics. And these are the awardee, the recipient of the scholarships. Currently is already 171 awardees from the more than 40 universities across Indonesia. So we already distribute, since by today, I think it's more than 5 billion already for the education fund. Yeah. And Alhamdulillah, last year we was awarded by the Islamic Development Bank as the ISDB Prize 2025 Impact for Achievement in Islamic Economy. Also in Indonesia, the Badan Wakaf Indonesia awarded us the most innovative Wakaf program. Alhamdulillah. And people are asking where we distribute the Wakaf benefits. The first priority is for the scholarships, and then social service, other health educations, and we also give the dental free caries program. We went to the school, bring our doctors, bring our nurses to do the healthy checking, dental checking to the students, to keep their those are healthy. Yeah. And we collaborate with many universities in Indonesia, with the University of Indonesia, the dentistry faculty, nursing faculty, faculty Islamic and business economy, also in Jakarta and others area. These are some of our awardees. They are now already graduates as a dentist, as a nurses. Yeah. No, they are not only coming from Indonesia, Jakarta, but they are also living across of Indonesia in other cities like Padang, West Sumatra, from Kalimantan, and from Sulawesi, and from other cities in Java. Okay. So, for example, like Dr. Rifai, he's now as a dentist. Yes. Dr. Rifai, one of our awardee, when he have a problem with the financial situations because of he lost the parents, cannot continue the dentist educations at the middle time of the situation. So the Waqf scholarship will continue because we know he is a very bright student at the time. So we try to give a better support. And now Dr. Rifai already graduated as a dentist and work in one of our clinic in Makassar, Sulawesi Island. So actually, it's very hard to bring the dentists or doctors to work outside Jakarta, outside the central cities of Indonesia, because we do many islands and many area, but our awardee is very good. They know they need to spread the benefit not only in the big cities like Jakarta, but also they want to give better treatment in rural area. So this the something that's the beautiful of the Waqf impact here, that we know that. Number of students also can reach more increase. We hope in the future will be maybe in one batch can be more than 100 students per program batches. Yeah. And other scholarship, we also bring the kids to our clinics to give the education of the healthy educations. And also we have donations, Ramadan social activities across the near the clinics locations in each of the clinic Waqf. We also go to the schools, to the currently in one of our clinic in Karawang, and you see the picture at the beginning, the slide, the first slide at the beginning, is the center of the dental treatment for the kids we have disability. So this is something unique for us when we combine the treatment for the disability kids in one Waqf clinic. So it's very special to serve them because we need a very good doctor, we need good nurses, and also with the medical model to treat the disability. But Alhamdulillah, we can do and then become the center for the disability dental treatment. Okay, this is the other program. We have a field trip, bring kids to the clinic, have a fun together with them, yeah. And we are also collaborate with others organizations within the university, with the Islamic Bank, and also with others organizations across of Indonesia. And not only that, we also distribute the Waqf for the donation for the aid for the disaster recovery, and also the Waqf of Quran. Yeah. In the future, what we aim, what are our goals, we want to collaborate with any institution in Indonesia, in other regions, and also globals. And what we are thinking now, we want to establish the first Waqf private funds for clinics and other productive assets expansions in the future. I think that's our presentations. Dr. Hisam, Dr. Samis, and ladies and gentlemen, maybe we can continue with the Q&A. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Afdal, for highlighting the transformative role of Medicaid's Waqf in funding hospitals and clinics, supporting medical education and medical research, and ensuring access to healthcare for underserved communities in remote areas in Indonesia. The video presented showed us a realistic picture of the work Medicaid is doing, and this demonstrates how Waqf, which is a centuries old institution, is contributing to healthcare. Now, building on this more broadly, Medicaids are playing a crucial role in strengthening the health sector by filling gaps in government services, particularly in the marginalized area. Now, the contribution extends from preventive health programs, advocacy, to direct medical services, capacity building. This demonstrates how the enduring policies of Waqf are being harnessed to deliver innovative, sustainable solutions to contemporary health challenges. Thank you very much for this. Now I have, before I open the floor, I have a couple of questions I want to ask before we continue. How do you measure the impact of your health program on the communities you serve? Is there a way or a method which you use to be satisfied that what you're doing is really giving the results you aim for? How do you are measuring the impact of this?
Okay. When you talk about how to measure the impact, first, because we are running the business entities as a Waqf asset, productive Waqf assets, the first one is we need to see the clinic in the profitable business operational. That's one of the key. After we know the clinic is operationally profit, and then the distributions of the impact, distribution of the benefits. Our Waqf give us the amanah to distribute more to the scholarships. When we first opened the scholarships, the first programs at the time, and I think it's only about 60 participants to apply. But now, when we open the first, the batch of our award scholarships, and then more than 1,500 participants who apply. So from that number, we understand that the scholarship of the Medicaids, of the productive Waqf scholarship, is already known by the people, can support their educations, and then we also become more selective. We try to continue the situation when the student is having problem with their financials. So that's the key. When the awardee complete their study, they can work in our clinics, not only in Jakarta. So in terms of the measurement of the impact, actually, we don't have like index or something's mathematical formula to calculate, but we just look at the number. We look at the number of the students increase. We look at the numbers of the participants also more interact with our situation, and we look at the number of the patients where the reserve is more every year. And also from the government give, look at our initiative, and then they're asking Medikits to collaborate with the government initiative. For example, when we try to talk with the governments, can we expand the Wakaf model not only in medical? The government will try to look at maybe we can expand the Wakaf model through the others Wakaf asset, for example, like transportations. So this is the business growing, the impact, the beneficiaries numbers also growing. So that's the simple measurement, Dr. Isams.
Right. Actually, this brings another question to mind. So, like, what partnerships with governments or hospitals or maybe other NGOs you have, and which are the most successful or critical to your success?
Mm-hmm.
Do you have
the collaboration?
Do you have any collaboration with other NGOs or other government
Yes,
or
we
hospitals?
do.
Yes.
Yeah. We do collaborate with others social foundations.
Right.
Yeah, they have, it's not the big social foundations, but they have Wakaf assets. They don't know how to do with the Wakaf money that they receive from the Waqif. And then at that situation, they give us the Wakaf assets and then to grow the Wakaf asset to be part of our clinic. And
right.
We give them back the dividend of the Medikits Waqf clinic to support their education for the imam of the masjid in some areas outside Jakarta. So with that Waqf beneficiaries, we can establish operationally some mosque. We run with a good operational handling, supporting from our clinic.
How about volunteers and local community members? Do they have a role in maintaining your programs?
Some volunteers coming from the student, actually. For example, when we try to communicate what we are doing through the social media, through the websites, through the webinar, something like this, we need to prepare materials. For example, the videos, the presentations, it's created by some of our students. So this is the volunteers, what do you call it? The works done by the students and the awardees, actually.
Mm-hmm. I see. One more question. What are your biggest challenges? Which challenges you are facing, in delivering your health care support, and how do you overcome these challenges? Do you have any challenges? I'm sure you must have. So can you just brief us on what are the biggest challenges you have, apart from, let's say, funding or getting enough funding, for your project, perhaps?
Yep. Okay, to bring the good medical service to the people in Indonesia, There are a lot of difficulties actually. The most, I think, a very challenge for us is how to generate the doctors, the manpowers of the health workers, doctors, nurses, radiographers, and all the support things. It's not easy to build a new doctors or new dentists because they need to have long journey of the study. So compare with other professions, for example, like accounting or even banking or management, it's a lot of university produce that graduate for that major, but medical dentists, even you have money, you cannot build a good doctors in just very short of time. So that's the challenge. We need time, we need people, we need the good potential students. Even we do have money, it's very, we need to teach them. So that's the challenge for the Indonesia dental and medical service here. The other challenge is how to distribute the manpower. For example, if you have a doctor or even you have a specialist work with you, with our dental clinics, it's not easy to bring them to work outside Jakarta. It's not easy to bring them to work in Sumatra, in Kalimantan Islands, in Sulawesi Islands. Because yes, of course, they want to become a doctor working in the central economy of Jakarta. That's it's something normal. But when we want to distribute the capability of the good service, dental service, we need to bring doctors to other locations. Through our awardee schemes, we can tackle that situations.
Right. Thank you very much. Actually, we can conclude that the model of Medicaid's walk-off can be really a good example to be emulated in other countries, and as you mentioned, maybe in Brunei and other parts of the world as well. Thank you very much. Now, I would like to open the floor for any questions to Dr. Afdal. Any questions at all? No?
Doctor,
it's all understood.
Could you please, Doctor, give me just 5 minutes to translate the summary of this presentation?
Yes, please go ahead, Dr. Sami.
طيب. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد. I will give in short the summary of this presentation. I think this is very important. طبعا الدكتور أفضل أنا زرته قبل حوالي تقريبا سنة ونص تقريبا في عيادته في إندونيسيا، وحقيقة الدكتور يعني عرض علينا أشياء كثيرة في العمل والجهد الهائل الذي قام به، لكن أنا باختصار سأعطيكم بعض المحددات. أولا هو تحدث عن حجم الأوقاف في إندونيسيا، وهذه المعلومة ذكرها الدكتور أيضا هشام، أن الأوقاف في إندونيسيا حجم كبير، 450 تقريبا ألف، يعني نصف مليون عقار وقفي في إندونيسيا، لكن المدور منه فقط حوالي 57 و200 عقار، يعني حوالي تقريبا يعني أكثر من 90% من العقارات الوقفية في إندونيسيا غير مطورة، وهذه مصيبة حقيقة. طبعا ذكر أيضا أنه حوالي تقريبا 250,000 من العقارات مخصصة للمدارس الدينية والمساجد، وهذا الاستثناء في الأوقاف المتخصصة في الصحة تعتبر يعني استثناء جيد. تكسر هذه القاعدة أنه الأوقاف يمكن أن تكون منتجة وخادمة للمجتمع. طبعا في المعلومات والإحصائيات التي ذكرها الدكتور أفضال، أنه بعد ما تأسست الأوقاف في عام 2016 ثم بدأت العمل عمليا من عام 2018، النتائج تخبرنا كما ذكر أنه النتائج يعني حقيقة إيجابية. ذكر من عام 2018 حتى عام 2024 كانت الأصول الوقفية حوالي مليار و400 مليار روبية إندونيسية، يعني مليار و400. الآن في عام 2024 أو في نهاية عام 2024 حوالي 14 مليار روبية، يعني في زيادة كبيرة في الأصول الوقفية. العيادات كانت في عام 2018 عيادة واحدة، الآن تقريبا 11 عيادة. المرضى عالجوا حوالي 4200 في أول سنة من عام 2018، الآن حوالي تقريبا 43.300 مريض تم علاجهم في هذه الفترة. يعني هذا كله نتائج وأرقام إيجابية تحسب إلى هذه الإدارة الوقفية المميزة. ذكر قضية في غاية الأهمية الدكتور أيسار، وهو أنه قد تكون عندك أموال وقد تكون عندك أصول وقفية، لكن المهم ليس في الذي يؤسس الوقف، المهم في من يدير هذا الوقف. ولهذا لما تحدث عن المتخصصين المهنيين الذين يستطيعون إدارة الأوقاف، وبالتالي كان يتحدث عن المنح الدراسية التي تقدم للطلبة الذين بعد ما ينتهوا من دراستهم في طب الأسنان أو التخصصات الطبية، يلتحقون لاحقا في هذه العيادات الوقفية المنتشرة في إندونيسيا. طبعا الشراكات والتوسع أهداف مستقبلية لهذا الوقف. وحقيقة هذا الوقف يعني أنا يعني كما يقال يعني اطلعت على بعض التقارير، يعني حقيقة تقارير مميزة وتؤكد أنه فيه جهد فيه استثناء، ويستحق حقيقة أن يقدموا، يعني أن تكون هذه التجربة تنتشر في دول العالم الإسلامي، أنه أوقاف التخصصية سواء كانت تعليم صحة تقدم على أنها حقيقة شراكة ما بين مؤسسة الأوقاف الحكومية وما بين المتخصصين والمهنيين في العالم الإسلامي. وشكرا دكتور.
شكرا دكتور سامي على هذه المداخلة، يعني للأخوة اللي يعني ما تابعونا بالعربي فعلا لخصت بشكل جيد. Now, if there are other
اسمح لي دكتور هشام.
notices or anything, I'd like to.
This is عبد الرحمن، أنا دكتور عبد الرحمن سليمان.
نعم.
حقيقة أنا عاوز يعني قدر من التركيز كما لخص دكتور سامي يعني هذه الندوة باللغة العربية. نتعرف على الموديل نفسه، يعني in order to market this model for other countries. النموذج المستخدم في الوقف الطبي للأطفال، باعتبار أن الكونتريبيوترز بيجمعوا كابيتال أوف وقف ماني، وهذا الأموال التي تجمع تعتبر في أصلها هي رأس مال الوقف. فهل يتم الصرف على السكولرشيبس ويعتبر هؤلاء الطلاب هم في حد ذاتهم أصول يعني في المسألة؟ يعني الصرف بيذهب مباشرة من رأس المال، ولا بيكون في استثمار من العيادات والصرف يتم فقط من الريع العائد من العيادات؟ هذا الموديل ضروري نحوكمه عشان نعرف وين هو الأصل وين هو الريع. شكرا جزيلا.
صحيح. فعلا. يعني إن كان هذه الوقف، وقف الأطفال ميديكيدز، هو وقف، يعني الصرف سيكون من ريع الاستثمار الذي يستثمره هذا الوقف. ولكن مثل ما فهمت كمان أيضا أنه هناك في يعني تبرعات تأتي من خارج الوقف ومتطوعين، مما يعزز يعني دور الوقف في مجال يعني العناية الصحية.
if you kindly يعني إذا نقلت التساؤل لدكتور أفضال يكون من الأفضل عشان يركز
Yes,
لنا
okay.
الموديل. Yeah, please.
Fine. Dr. Afdal, Dr. Abdurrahman was
Yes.
asking that since your Medicaid is a waqf, the money that you are spending on your services, is it being spent from the capital of the waqf or from the returns that you get from investing that capital? Because as a waqf, you cannot, the rules of the waqf, dictate that the waqf asset should be preserved, and what can be spent can only be spent from the return that that investment generates. So can you please elaborate on this, the money that you are spending? Is it being spent from the investments that you get from your waqf, or is it from outside sources that supplement what is generated from the investment?
Okay. So firstly, I think the Waqf money that we got from the Waqif, that's the initial Waqf funds that we collect from doctors, from our families, from friends, and others, people who want to support the Medicaid Waqf program at the first time. So the Waqf money, we established the clinic, Waqf clinic. We use the money to pay rent for the clinic office. We use the money to buy the medical equipment. We use the money to renovate the clinic, and we use the money to run the operationally clinic. Yes. And then after the clinic running, it will start to get the revenue. So with this revenue, clinic will operate independently, because clinic will not need more additional investment from the other Waqif, only at the beginning. And the revenue of the clinic, some will be supporting that clinic operationally to pay the doctors, to buy the dental materials, to buy the medicines, and the net profit of that revenue of the clinics then will be distributed as the Waqf benefits. So
Right, thank you.
the clinic will stay in the clinic, and then the net profit will distribute as a Waqf benefit. And some of the Waqf benefit we also use to generate another clinic, establish more clinic in the future. That's the model.
Thank you very much, Dr. Abdurrahman. Did you get all that?
Yes, it's very clear to me, but I just would like to ask about the money which is spent for the scholarships. Is it gone directly from the capital or only from the benefits?
For the scholarship, only from the net profit, dividends from the clinics.
Yeah, it's clear. Thank you very much.
You're welcome.
Dr. Afdal, tell me, are your services free, or do you have some sort of a means test where you can say, all right, these are genuinely poor, and therefore I'll give them free medical, and some I have to charge? I mean, do you assess the patients according to their capabilities or their ability to pay, or how do you discriminate between patients?
Okay. The clinic are professionally operate as a commercial business. So people to become a patient need to pay with the market rate. But then we have some allocation from our foundation to support Duafa, but
Right.
not to become a free treatment. Duafa still need to pay for the treatment, but the money we ask from them, but our foundations will pay for the Duafa treatment. So we cannot put the clinic operate just for the free programs, because with the free program, clinic will not generate any income. So we need to keep a business as a normal business-like model. The other situation for the social purpose, the foundations and other social organization will pay for the Duafa patients. So that's the situations.
Dr.
Okay.
Dr. Defterdar, I think this is the right model even for the Waqf. Waqf is a commercial company, but it's generate the return as يعني واقف condition. يعني nothing make as a donation or charity, or Waqf is a company, but it governed by Waqf rules. So I think this model is very nice, and it can be promote يعني for other countries as a best practice.
Yes, you're right. Okay, Dr. Abdal, I want to ask, are there any medical services that you exclude? For instance, cosmetic surgery, for example, or things like this. You know, there are some treatments that perhaps do not qualify. Do you have rules on these things?
Of course, yes. We do not do the cosmetic surgeries or cosmetic. I mean, the dental treatment is only for the we have a medical committee. For example, when we do surgery, it's only because of the patient is really need that surgery, not because they become more handsome or become more pretty, not like that. Yeah. Mm-hmm.
Yes. Okay. Thank you very much.
And
all
we
right,
also have other service for the vaccinations.
Yes. Thank you.
Mm.
طيب, are there any other questions before we conclude?
دكتور محمد
السلام عليكم.
تفضل
دكتور سامي.
متاح نسأل سؤال؟
تفضل.
الله يعطيكم العافية يا رب. دكتور محمود طلوزي من سوريا، ومقيم حاليا بين سوريا والسويد. دكتورنا الفاضل، بما أنه الوقف يتبع منظمة أو جمعية كبيرة، هل يمكن للجمعية تضغط على المستفيدين منها بحيث تلزم الأطفال أو العائلات التي تأخذ مساعدات من الجمعية بإجراء عناية جيدة بالأسنان؟ يعني تجربة مثلا عندنا بالسويد إنه المدرس ملزم يبعث بلاغ للشؤون الصحية إنه الطفل فلان أهله غير معتنين بسلامة الأسنان، ما في تنظيف جيد، وبالتالي السلطات تحقق مع الأهل ليش الإهمال. وكما نعلم درهم وقاية خير من قنطار علاج. الكثير من أطفالنا
Yes. Dr. Mahmoud? I think we ran short of time. Dr. Sami?
الدكتور يعني كان اتوقع الان يمكن بيرجع، لكن في الدكتور عبد الرحمن سليمان عنده سؤال ايضا. الدكتور عبد الرحمن سليمان عندك سؤال؟ رافع يده.
بس بدنا نشوف الجواب على الدكتور محمود.
جيد، لو تسأل دكتور. نعم جيد.
Dr. Afdal, Dr. Mahmoud from Sweden was asking if there is, let's say, cases where the treatment or the malady was generated because of negligence from the family, that they are not asking their children to brush their teeth before they go to bed or something like this. How do you deal with cases like this?
Okay. Yeah. Okay.
Educating the families, because when you are treating kids, actually the real beneficiary is the parent, because otherwise he had to pay for the service on behalf of the kids. But therefore, there is responsibility on the family. And how do you make sure that this responsibility is discharged properly?
Okay. So in Medikids, first, we have a special treatment for the kids. Before going to see the dentist, kids we can play with what we call the play hospital. In that play hospital, kid is doing like role model, become dentists, become nurses, become a patients. So in that situation, our nurses will guide the kids to understand the treatment, to understand how to maintain the good health of the teeth and mouth. So in our clinic, not only to like a curative treatment to help the kid with their dental problem, but also for the education. So in these situations, yes, I agree with you. Parents are responsible for the health situation, health condition of the kids. And that's why in Medikids, it's not only for the kids, but also for the family. So when first they, for example, a lot of our patients, they bring the kids to the dentist, and then the doctor also teach the parents at the same time. And after that,
Okay.
the parents will also become the patients together with the kids.
Thank you very much, Dr.
أعتقد دكتور هشام في ذات المسار تبع الأخ المقيم في السويد، أنا أعتقد أنه هو طبعا غاب من انقطع اتصاله، لكن أعتقد هو قصد أنه لو كانت هناك جمعيات خيرية تمول علاج الأطفال، وضرب مثال الأسنان، وطرح شقين. الشق الأول، هل بيكون في مساءلة على البيرنتس إذا أهملوا في بلاد معينة؟ طبعا ده ما في كل البلاد، في السويد، في بعض البلاد الإسكندنافية المتقدمة يوجد هذا النظام، تتبع الحالة وصحة الطفل ومش عارف إيش وكلام زي كده. لكن أعتقد أنه كان يقصد أنه إذا كانت هناك جمعيات خيرية بتدفع لسطش كيتس، فهل هذا الوضع بيكون بشكل إلزامي؟ يعني يجب على هذه الجمعيات إنها تدفع لعيادات وقفية معينة، ولا تروح للسوق بشكل عام؟ أنا هنا برضو بتطوع بالإجابة، بقول إنه العيادات الوقفية هي مجرد عيادات تجارية توظف ريعها في أغراض إنسانية أو خيرية للأطفال وما إلى ذلك. هذا هو النموذج. هذا اللي أنا بس حبيت أوضحه في الشقين. شكرا.
Right. Thank you, Dr. Abdulrahman. All right. Are there any other questions, comments, anything?
Doctor, the last
Anybody?
question, Doctor, I got it from someone. He sent it now. He asked
Yes.
Dr. Afdal regarding the relationship with the Awqaf management, the public Awqaf management in Jakarta, how they deal with you, how they support you by lands or just...
Oh, you
You
mean the
mean,
support from the Waqf?
Not from
Waqf,
Waqf, from the management of public awqaf, government awqaf, how they deal with you
governments.
as a new
Yes.
model in Indonesia. Yes.
Okay. Unfortunately, yes, we still have homework in Indonesia about that, how government can support the Waqf development. Yes, we know we run the Waqf assets. This is also the discussion when I found this when I went to Jeddah to discuss with the Islamic Development Bank. The issue maybe in your countries, government will support the Waqf assets. But in case of Medicaid's Waqf, we still lack of support. We're not asking for the big support from the governments, but we want to support is not big, but I think it's very normal. For example, as a business entity, we want maybe for the electricity tariff, can we have a reduced tariff for our electricity that we pay? Can we have a special tariff for the rent? Can we pay special tariff for the tax? We're not asking them for the free tax or free infrastructures supporting, but we want have privilege. That's the situation that we still like in Indonesia, but I'm still continue to discuss with our governments, to the Waqf board in Jakarta in Indonesia. Maybe someday in the future they will give more better support for this kind of development.
Why I ask you this question, because your model is a unique example in Indonesia, and the critical point, you work under the traditional management, I mean government management, and this is really we ask God to help you and support you in your job, because really when we listen to the huge land, awqaf land in Indonesia, as you said, and as we listened from the government office last time when we visit Indonesia, 500,000 of real asset awqaf land in Indonesia, but only 10% developed, and majority nobody use it. So why didn't give you this land to use it as the new good example, and you really achieve a good result in your job? That's why I hope the government, Awqaf government in Jakarta understand this situation. I think you gave us a unique example in the Muslim world.
Inshallah.
Inshallah.
Yeah.
Right. Thank you very much for an excellent presentation. We've learned a lot about Medicaid and about your work in supporting healthcare and Medicare and all that in Indonesia. This is a great model to be transferred to other countries as well. We have learned a lot, and we wish you all the success in what you're doing. And inshallah, the Indonesian Waqf will appreciate what you're doing and will really contribute more by way of land or whatever they can do.
Inshallah.
And if we can have any support in that regard, Dr. Sami and myself, will be quite happy to visit with you and present a case on your behalf as well. Thank you very much.
Me too.
Yes.
Yeah,
and Dr. Abdurrahman as well.
Yeah.
No, I will not leave you to go alone. Inshallah.
Yes. And I'm sorry my camera wasn't working, but I'm not that photogenic anyway. Thank you very much.
Yeah.
So that this concludes our session. Dr. Sami.
جزاك الله خير دكتور. Just we make the دعاء سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت نستغفرك ونتوب إليك.
شكرا جزيلا.
بارك الله فيكم.
Thank you, Dr. Isam. Thank you, Dr. Sami.
شكرا
Dr.
دكتور
Abdul
عبد
Rahman.
Thank you,
Dr.
Dr. Abdal.
Mustafa.
ما
Thank
في
you.
صورة جماعية يعني؟
If you
إن
take
شاء الله.
gathering photo.
Okay.
Sure.
All please.
دكتور عبد الرحمن تاخذ صورة من عندك؟
ما بعرف إلا أخذها بالتليفون.
دقيقة. If you please open the cam, please.
Okay.
Thank you,
Done?
Doctor. No, yes,
Okay.
جزاك الله خير. Thank you.
Thank you. Salam alaikum.
شكرا دكتور.
Thank
Thank you.
you. Assalamualaikum warahmatullahi
Alaikum
wabarakatuh.
salam.
Thank you.